Today, I want to talk a little bit about OCD. Hello, I'm Dan. I'm a clinical psychologist and the director of Lavender Psychology, an LGBTQIA affirming and neuroaffirming practice here in Sydney CBD. OCD is often talked about like being neat, organised, or liking things a certain way. But for a lot of people, OCD can look very different to that. It can look like having a thought pop into your mind, like, what if I hit someone with my car on the way home and didn't realise? And even though a part of you knows that probably didn't happen, your brain won't quite let it go, or you replay the drive over and over again in your mind, trying to feel completely sure. Or it might be something like, what if I said something really mean and I just can't remember? Picking apart what you said, how you said it, and how the other person reacted. Trying to work out if you said or did something wrong. Or it might be something like, what if I didn't turn the stove off properly? So you check, and then maybe you check again and again and again. Or you try to remember exactly what you did. We try to get a feeling of certainty that it's safe, but it never feels quite fully settled. Sometimes OCD is very visible, and sometimes it's almost entirely happening internally. The details can look very different from person to person, but the feeling underneath is often very similar. A sense that something isn't quite resolved, and a need to feel certain. OCD stands for obsessive compulsive disorder, and it's made up of two main parts. Obsessions, which are intrusive, unwanted thoughts, images, or doubts, and compulsions, which are the things you do physically or mentally to try to feel safer, more certain, or more settled. And what tends to happen is a loop. A thought shows up and it feels really important or uncomfortable. You do something to try to fix it. You might get some relief. And then the doubt comes back again and again and again. So OCD isn't really about liking things clean or organised. It's about getting stuck in a loop where something feels unfinished, unsafe, or uncertain, and your brain keeps trying to resolve it. One way to understand OCD is as a particular way of brain processing, especially around uncertainty, responsibility, and safety. Your brain is essentially trying to protect you, but it gets stuck trying to resolve things that don't have a clear or certain answer. And that's what keeps the loop going. So it's not that your brain is broken, it's that your brain is working really hard, just in a way that gets a bit stuck. Something really important to understand is that OCD often latches on to what you care about most. If you care about other people, the thoughts might be about harm, such as, what if I'm capable of hurting someone, even though I don't want to? If you care about being a good person, the thoughts might be about getting something wrong, such as worrying about lying or being unfair, even though you didn't mean to, or needing to be completely certain that you haven't done something wrong. So the contents of the thoughts isn't random. It's often connected to your values. And that's part of why OCD can feel so convincing. OCD isn't caused by just one thing. It's usually a mix of how someone processes information, their temperament, and life experiences. Some people have brains that are just more sensitive to uncertainty or threat. And OCD can develop from that over time. It's not something you choose. In therapy, we usually think of OCD as something to work on when it's causing distress, taking up a lot of your time, or it's starting to interfere with your life. Not just when the thoughts are there, but when the loop itself starts to take over. The good news is that OCD is something we understand quite well. There are really effective therapies like exposure and response prevention and approaches that help change your relationship with these thoughts over time. So even though OCD can feel very intense, with the right help, it's also very manageable. OCD can feel really convincing, and a lot of people can experience it for a long time before realizing what it is. But when you start to understand the pattern, it can feel a bit less confusing and a bit more possible to manage. If any of this resonates, you're welcome to reach out. We can take things one step at a time.